This video is going to focus on the use of token economies as a method of helping people cope with schizophrenia. Now, you may kind of think as we're looking at them as the last one of the psychological therapies that this would also be called a therapy, and it will share some of the features with it because it's definitely going to help individuals manage with the condition. But you'll notice how the terminology we're using here moves from a therapy to management, and that will become clear when we look at actually what the aims of token economies are. Okay, so token economies are a reward system, and it's really useful to think back to token economies that you might have been part of. So any time where we are given a token, given a credit, given a point for something as part of a reward system, and then we can use that to exchange it for a larger reward, we are part of a token economy system, and these exist within a range of different institutions, including schools. So schools that operate a house point system or a behaviour point system where students would accumulate credit that they then would get a reward for, that's all going to be the same as the token economy. And I'm pretty confident that if you think back to your primary school and secondary school experience, you can think about periods of time where you've been part of a system such as that. So what we're going to use them for here is to help people manage those negative behaviours that we'd associate with schizophrenia. And as we look at its use for adults, they are primarily used within individuals who have been institutionalised, where they are operating within a place that's external to where they live. And in this sense, we're going to focus on those features of maladaptive behaviour that may well come as a result of spending a long time within those institutions, in this case specifically psychiatric hospitals. Now, the reason we're switching that terminology from talking about therapies to talking about methods of management is that the aim of token economies isn't to cure schizophrenia. We're not trying to eliminate those symptoms. What we are trying to do is support individuals having a more successful level of functioning where they can operate better on a day-to-day basis and hopefully translate that to being able to continue those more successful routines once they're outside of that hospital setting. Okay, so one way in which you can develop your knowledge and description of token economies is by talking about the concepts and theories that exist behind the token economy system. So if we think about what we've just presented there, in a sense that it's a reward system and it's about being able to provide people with a positive outcome to certain behaviours, then we would be thinking about those approaches, and hopefully the behavioural approach, those operant conditioning processes are the ones that are springing to mind with this. So if we break this down, we've got a therapy where we've got desirable behaviours that are encouraged by the use of those selective reinforcements. Okay, so we are identifying what we deem as positive behaviour and we're making sure that they are reinforced with some sort of reward. So this is of course based on operant conditioning, and it does have elements of classical conditioning, because if you think about the generation of a positive association between gaining a reward and the associated behaviour, then it's going to have elements of that. But of course, it's with those reward factors, it's going to be ticking a lot of those aspects of operant conditioning here. Now, the terms we need to get used to use, and these are things that we've used before, both in the behavioural approach unit, but we also mentioned them when we talked about attachment theory and the learning theory of attachment, is primary and secondary reinforcers. So primary reinforcers would be those ones that would cause us pleasure, as the actual thing itself causes pleasure, and a secondary reinforcer is something that would lead to us gaining that primary reinforcer. So primary reinforcers could be things like food. We eat food, it would give us pleasure. A secondary reinforcer are things that we might access in order to get that food. So last year in our attachment unit, we described the mother as a secondary reinforcer because she was the individual that led to the delivery of food to the child. In this scenario, we are going to be talking about the rewards themselves, those things that cause the individual to pleasure, so the things that they're going to exchange for the tokens to be the primary reinforcers, and the tokens themselves, the things that they exchange, are going to be those secondary reinforcers. Okay, so how do token economies work in practice? Well, we have those tokens and they're going to be paired with the rewarding stimuli. So that rewarding stimuli could be a coin, it could be a piece of paper, but it helps it to be something physical because it's just much more of a visible, tangible thing for the individual. The individuals who are operating the token economy system are going to be looking out for those desirable behaviour, and whenever they see those desirable behaviour, they're going to give tokens for engaging in those. So we're going to be able to have that hopefully quite quick process where as soon as that positive behaviour is seen, then the individual receives that token, and either just through one token or through the collection of many tokens, that can then be traded in for a desirable item or an additional privilege within that institution. And although we are talking about it in the context of schizophrenia here, token economy systems have also been used within prison settings. And as we move on to forensic psychology, we'll use exactly this type of process to explain how more positive behaviours are brought out in those settings. In the context of schizophrenia, we're going to be talking about engagement in more positive routines. We're going to be talking about maybe keeping up with a hygiene routine, talking about normal social processes that individual might develop, talking about controlling of aggression and rage types behaviours that might be the outcome of those dysfunctional thought processes. Now, a few things that we can put in that's going to affect the success rates of a token economy system is the immediacy of reward. Especially at the start of the process, we need that reward to happen straight away. Otherwise, the connection between the reward and the behaviour is weakened and the link isn't made as successfully by the individual. One thing that's found to be more useful is that the person receiving the reward has something they really appreciate, and therefore offering a variety of options for that reward can be something that helps the system work as best as possible. Clearly, if the person doesn't value the thing that they're trading in the tokens for, then that's not going to generate the same level of motivation. If there's more variety of options, then it's more likely going to find that thing that motivates them. Okay, so a key question is, well, how are we differing then between our other psychological treatments for schizophrenia? So how does this differ to family therapy, to CBTP? Well, the heart of it is in the fact that we are at quite a surface level here, just trying to see a change in behaviour. There isn't that in-depth breakdown of why that behaviour is occurring or potential causes. The causes of the behaviour are never tackled in token economies. All we are trying to work with the individual to do is focus on the presentation of more successful behaviours. So we'll see that in the evaluation again as part of our potential issues with this, because although we might be dealing with what's happening on the surface, if we don't deal with what's happening beneath that surface and the things that are driving those negative behaviours, then potentially they're never going to stop, and all we're going to get is a masking process that will eventually stop happening at some point. Okay, so let's look at our key evaluation points here for token economies, and the first research study we'll look at is Paul and Lentz's 1977 research. So this is a research study that can help support the effectiveness of token economies and that they work in the management of schizophrenic symptoms. So as part of their research, they reported that operating under a token economy system led individuals to have better functioning and have less incidence of behavioural disturbance. They are also seen as being more cost effective. Now, in this sense, cost effective is going to refer to whether they are saving money or costing money for the institutions that run them. If we're saying they're cost effective, it means that the outcome of it and the positive impact is saving money and more money than we're spending out on those rewards that we're providing for the individuals in the first place. So that's obviously a really positive thing, because it means that it's more viable to be operated within more institutions. If it was a hugely costly way of managing behaviour, then that's going to be something that's going to inhibit it, especially with tight budgets surrounding hospitals and mental health. Okay, our second research study here is actually looking at some of the question marks that are raised over the studies that have shown those token economies to be effective. So McMonongle and Sultana looked at this, and they found that out of the studies that were trying to show effectiveness of token economies, only 3 of those used random allocation. So it means that when they looked at the individuals, that they were randomly assigning them to the token economy or non-token economy group. It might well be that there are other factors therefore influencing which group people ended up in, quite possibly how well they thought they would apply themselves and be able to work under token economy systems. Therefore, it becomes a biased study, and we can't be certain, therefore, that it was the token economy having a positive effect rather than the nature of the individuals who were put in each group. In addition, out of the 3 studies that did show that only one of the regimes showed an improvement for negative symptoms, and therefore that puts a question mark over whether it's really supporting the full range of schizophrenic symptoms. I have again as a big question mark over this is whether we see a permanent change in individuals' behaviour, and once the token economy program had finished, whether people continue to do that. Now, reinforcement theory would suggest that once the behaviour is stamped in by reinforcement, then it becomes habitual and people would do it instinctively. However, we do have concerns here that once the rewards are removed, that individuals continue with those behaviours, and actually there's a lot of anecdotal evidence that people just revert back to the behaviours they'd shown before the token economy programs. Okay, so the Kasdan et al. Research is focused on whether that continuation of behaviours continues when the token economy process works. And here we do see the fact that we have research that is critical of it. It suggests that what we're dealing with here, as I said right from the start here, is a very surface level way of managing it. It's dealing with those outward behaviours that people can potentially mask for short periods of time, rather than trying to get to the heart of it. Now, a lot of students, when they write evaluation of token economies, will almost just write off token economies because of this and say, well, it's not helping deal with schizophrenia, therefore we shouldn't see it as a successful therapy for schizophrenia. However, it's important that we see the role of these psychological treatments and therapies. A lot of our psychological treatments aren't setting out to try to deal with the causes of those symptoms. They are just being seen as additional tools that, as part of the bigger picture of therapy and as part of engagement in biological therapies such as antipsychotics and other psychological treatments, can help support that individual being able to function. So the question you could raise in your essay here is whether this all matters, and that if the individual is actually showing more positive behaviour, even for short periods of time, whether this process should still be acknowledged as being a positive one that exists as part of, I say, that whole range of different tools that can be used to help individuals with schizophrenia. This evaluation point is focused on ethical issues. So what we are referring to here is whether individuals are being treated in a fair way and whether their human rights are being upheld. Now, of course, psychological therapies like token economies wouldn't come with the same issues involving side effects that we'd see in drug treatments, but there are still ethical issues that people raise with this. What we would argue here is that we are treating people and we are withdrawing privileges from them for showing symptoms of schizophrenia. Now, the discussion that we can have here is whether it's appropriate to make that decision on somebody to withhold privileges because of genuine mental health behaviours that they're showing. Is that the right way that we should be supporting people? How does that make them feel as a human being if they're being put in that scenario? And it's actually worth remembering that I introduced this with talking about school type processes and how we entrain successful behaviours with young people. Well, actually, if we're doing this with full grown adults, does that lead to this belief that we're treating people like children and we're doing it because of mental health issues that they have, in a lot of cases, very little control over? So the ethical debate surrounding token economies, and I'd particularly direct you to focus on the withholding of privileges as part of this process is something that you can shape into an evaluation point here. Okay, so just to finish up this session, a good activity to do is to have a go at completing this table. Now, you can do it in a couple of ways. You can either just use the column and row headings to be able to do it from a complete blank start, or you can use the different information that I've given you there to help you be able to make some notes so you can see the type of things that you want to use as sentence starters. So you can make this easy or difficult for yourself, but this is a really nice way of summarising what these different psychological therapies, ways of managing schizophrenia are about, and also breaking down those different evaluation points. So I know that's something that you've asked up until this point, what sort of areas would we cover in evaluation? Well, this is a really nice process to go through. What's the evidence to support effectiveness? How effective is that over the long term? How well suited are they for different types of individuals? What sort of appropriateness issues also exist? Do they come with side effects? Do they come with other negative impacts on the individual from engagement? What's the role of the individual and how motivated, how active do they have to be? And do they work as well within institutions as they would do within home community settings? Okay, so have a go at that, and that will hopefully bring this lesson all together.